This is an asthma presentation. The first part of this presentation is demographic stuff, okay, from the nation, then to the state, and most of this information is from the Department of State Health Services, and you can get there. I'll have the reference at the end of the slideshow that you can go there and look up stuff if you need to. All right. But I do this to relate the importance of treating asthma, and that it's not just a small problem, but it's worldwide and it's significant. You know, there's deaths every year, and as far as I'm concerned, one death is too much, and so that's what this is about. As we go through this thing, our intention here is to treat these patients at home, all right, before they get to the hospital. Now, obviously, as respiratory therapists, we're going to see these people in the hospital, but the intention of this project is that they're going to be treated at home. Some of the symptoms you're going to see in asthma, and you kind of work your way down the list here, where the cough is going to be the first symptom, most likely, and then chest tightness and shortness of breath and wheezing. And the idea here is to keep them from progressing down this list. All right, so if they start coughing and recognize that that's probably asthma related, then you're going to get aggressive with our medications and hopefully prevent it from progressing here. A lot of people think of asthma and they think of wheezing. Well, actually, wheezing is a really advanced symptom of asthma, and you know, if that's the case, if we don't get to them or they don't get to us until they're wheezing, then we're going to have a pretty big struggle on our hands trying to get these symptoms reversed. Everybody has their own triggers. Every asthma patient has their own triggers, and these are some of them. Okay, allergens are things you're allergic to, right? Irritants, and we'll discuss those in a minute too. But those can also affect the non-asthmatic patient and give them asthma-like symptoms. Weather changes, viral or sinus infection is a very common one, because you know, as we get a sinus infection, you know, especially in young children, very easy. And of course, probably get a viral infection in the form of a cold or the flu every year, so it certainly can set off your asthma. Exercise is another big one, and so as we go through this, we got to make sure, as we treat our asthma patient, we have to prevent the exercise-induced asthma, or EIA. Reflux disease is another trigger, and many times that comes together with asthma. So that's something that we have to, the reflux and the infections and asthma all go together, and they pretty much come on the same chromosome, from what one doctor tells me. So that's the reason they're so common together. Some medications in foods, and emotional anxiety. That's a real trigger for some people, so we got to be aware of that. Okay. So if you have asthma, you can minimize your symptoms by avoiding the factors that trigger your symptoms and working with your healthcare provider to manage the symptoms. And I have to tell you a personal experience here. We had my son allergy tested, and it turns out he was allergic to one of the shrubs that we had growing around our house. And so guess what? My flower beds are now bare. And so he hasn't had he still has some allergy stuff, but he doesn't had any that evolved to the asthma, to the extent of asthma yet. So I'm hoping that helps, because my house is really ugly around the yard. So allergens versus irritants. Allergens affect only the people allergic to the substance, right? And irritants affect everyone if the dose is high enough. You know, that might be noxious gas or even dust, something like that. But anyway, things that give you asthma-like symptoms. Hay fever is a risk factor in developing asthma. And so if you have allergies, you got to treat your allergies to prevent the asthma. And so, of course, allergies are not fun anyway, right? And so you're going to treat them, but you know, if you don't get them treated or you don't stay on top of it, it will lead to an asthma flare. Some common allergens: pollens, molds, animal dander, house dust mite. Sorry, if you live in a house, you have dust mites. I don't care how clean you keep it. Same thing with cockroach droppings. If you have a house, you have cockroaches, even though you may not see them. But the droppings that they leave behind sometimes cause allergies. Okay, and I know we're all very good housekeepers, right? And so we don't think we have cockroaches, but we do. It's important to avoid these things as much as possible. Okay, it may be that, you know, if you have an inside pet like a dog, say, it might be that if you're allergic to the dog, you might need to move it outside, make it an outside dog. Or, you know, in some cases, if you're allergic to the grass or the trees that it might be outside rolling around in, then it brings it in the house. You know, that's another issue too. So it can be kind of a double-edged sword there. Some irritants: air pollution. Obviously, tobacco smoke is a big one, and so really no one should smoke in the house where there's an asthmatic. Wood smoke, you know, like from a fireplace or a campfire. Chemicals in the air, that's one thing we have in the Permian Basin. We got a lot of chemicals, and so we have to be on guard for that. Ozone, this is in the atmosphere itself. Now some devices produce ozone, and so if you have the air filters or air freshener type machines that don't have a filter on them, a lot of those produce ozone. And so if they have a funny smell about them when you turn them on, they're probably producing ozone, and so they probably need to get that replaced. Some occupational exposures: vapors if you work, like, you know, around chemical plants, or even not if you don't work for the chemical plant, but maybe you live downwind from a chemical plant. Some of those vapors are very irritating. Dust is one, gases and fumes. And fumes might be as simple as a perfume. So you got to be diesel fumes at the gas station, anything like that, if you have very sensitive airways. Okay, strong odors or sprays, house cleaners. Yeah, like I say, I know we're all good housekeepers, and we use all kinds of household cleaners to mop the floor, to wipe the cabinets down, to clean the bathtub, things like that. Just make sure there's plenty of ventilation there, or circulating air, and hopefully we'll keep that to a minimum. Changing weather conditions. In Texas, you don't like the weather, just hang around for a few minutes and it'll change, right? So changes in temperature, humidity, or barometric pressure. Strong winds, and again, referring to the previous list, dust, that the strong winds might kick up. So we've got to keep on guard for that. Viral infections, cold or pneumonia can trigger or aggravate asthma, especially in young children. These infections can irritate the airways, nose, throat, lungs, and sinuses. And this added irritation often leads to asthma flare-ups. So what this is this is a red flag for us. And so as we see these things going on, you know, the child comes to us and complains of a sore throat or my nose is stuffy, something like that. Well, not only treating those symptoms, okay, then we need to start loading them up with the asthma treatment in addition. So that's what we're meaning here. If they get a cold, yeah, we'll treat their cold and their asthma. Sinusitis can trigger asthma. Okay, so we've got to keep their sinuses clean. Okay, my poor son, until he was 4 years old, had big time sinus problems. Till we got him allergy tested and we started getting him some allergy shots. You know, he was on one round of antibiotics after another. Okay, but finally, when we got his nose cleared up, okay, well, guess what? He actually got hungry too when we got his nose cleared up, because now, you know, that's part of taste is having your being able to smell your food, and he didn't have nearly as many problems with his asthma. Strenuous exercise, exercise in the cold, dry air, prolonged strenuous activities such as distance running can increase the likelihood of exercise-induced asthma. A couple of things here about exercise-induced asthma. You need to prevent this by pre-treating it, and pre-treating with a rescue medication such as albuterol 15 minutes before you begin the activity, or if you're using a maintenance type medication, 30 minutes for the maintenance type medications before the activity. And then you do a good warm-up, okay? And then you might need to be concerned about, you know, where the exercise is going to be. You know, if you're playing soccer and you're out in a grassy field, you know, are you allergic to the grass? You know, will that flare your asthma? Okay, or you know, if you're running a 5K or something out in the cold weather, then you got to be careful about that. And I don't know if you're like me, while you're running, you're breathing through your mouth anyway. So if you have very sensitive airways, that can also be a problem. Reflux disease or GERD can affect patients with asthma. And what this is this is a condition in which the stomach acid flows back up the esophagus. Most of the time this occurs at night while you're sleeping. Okay, and so while you're asleep, you wake up with this. When you wake up, you have this awful taste in your mouth. That's your stomach acid. And what happens is you aspirate some of this acid in your sleep, and the acid irritates the airways, and it can cause your asthma to flare. Okay, so a lot of people don't even know they have reflux because it happens at night, and the only symptom they have is they wake up and they have this bad taste in their mouth. And so a lot of people, you know, they say, well, do you have this problem? They say, well, I don't think so. And then so they give them a treatment just to try it, and they feel so much better afterwards. So it's kind of a silent disease, if you will, silent trigger. But many asthma patients suffer from this and may not even know it. Medications as triggers. Some adults experience an asthma attack as a result of taking certain medications. Big ones are aspirins or NSAIDs. These NSAIDs are non-steroidal anti-inflammatory, like ibuprofen or things like that. Now, the one thing that's not on here is Tylenol. Tylenol is not an NSAID, okay, and it's not an anti-inflammatory. So ibuprofen and the others escape me right now, but things like that can cause problems. Some treatments for heart conditions or blood pressure or migraine treatments include beta blockers. And so if we're, you know, most of the medications that we deliver are beta stimulants. So if they're taking beta blockers elsewhere, that could be a problem for the patient if they're trying to treat their asthma with the beta stimulants. So, we might have to find other avenues for both treatments even. So it could be a problem. Emotional anxiety. Anxiety and nervous stress can cause fatigue, which may increase asthma symptoms and aggravate an attack. Proper rest, nutrition, and exercise are important for overall well-being and can help in managing asthma. And of course, that's just a good rule of thumb anyway. All right, asthma management includes using proper medications to prevent and control asthma symptoms, to reduce airway inflammation. Prevent and control asthma medications are categorized into two general classes: a quick relief or rescue type medication, and a long-term control or maintenance type medication.